Okay, let's unpack this. Picture a neurosurgeon.
Mm-hmm.
Just the word makes you think of incredible skill,
Yeah.
right? Years of intense training, life-altering decisions made in minutes.
Absolutely.
Their world is the brain, the spine, the nervous system. It's demanding clinical work at its absolute peak.
Yeah, the dedication and sheer focus required just to get through that training, it's immense. It really shapes them into these incredibly capable clinicians.
Right. But here's the twist. The thing that really jumped out from the material you shared with us, what happens after those grueling years?
Yes.
Turns out there's this massive challenge most aren't explicitly trained for,
Uh-huh.
dealing with and, managing the business of medicine.
It's a fascinating disconnect, isn't it? You've got someone at the very pinnacle of specialized medical knowledge,
Mm-hmm.
suddenly facing questions about, well, building a practice, marketing, operations, stuff that was likely completely outside their formal training.
Exactly. And that's precisely what this deep dive is all about today. We're
Right.
digging into the sources you provided articles, looking at both the unique career hurdles for neurosurgeons and this growing role of outsourcing in healthcare.
Yeah, our mission here is to really pull the threads from this material. We want to understand these significant non-clinical burdens neurosurgeons face
Right.
and explore why looking at their practice like a business is so crucial, even if it feels maybe counterintuitive after all that clinical focus.
Mm-hmm.
And then see how outsourcing is being presented as a strategic way to tackle some of these very real issues.
So let's jump right in then.
Ready when you are.
Okay, so the material you gave us lays out this core problem pretty starkly. Neurosurgical residency, it's designed to be this incredibly intense time focused almost only on clinical training.
Right, the goal is to make the best possible surgeon.
Exactly. But when you step out of that environment, you're often, well, according to the sources, kind of unprepared for the practical side of things. Managing your career, let alone building a practice.
It's almost like training someone to build, I don't know, a Formula One car,
Yeah.
but never teaching them how to manage the pit crew, the logistics, or the team's finances. The main focus is that elite technical skill, which is vital, obviously.
Obviously.
But the real world needs so much more beyond the operating room itself.
And one of the first big decisions for those fresh graduates, the articles note, is that basic question. Okay, where do I go from here? Academic medicine or private practice?
And the material's quite clear on why private practice often presents the bigger challenge.
How so?
Well, they argue the training tends to mold neurosurgeons more towards that academic or institutional setting. It really falls short on those, critical business nuances. It's a tough reality, but a great surgeon, someone with fantastic clinical skills, can actually fail at building a successful private practice simply because they lack that business understanding.
Okay, now here's where it gets really interesting, maybe a bit surprising. The sources bring in this perspective, almost looking at neurosurgery from an MBA's point of view.
Ah, yes, that analogy.
They describe it as being like labor work.
That is striking, isn't it? The idea is that, sure, persistence brings returns, but the fundamental output, the core service, is tied directly to the individual surgeon's physical presence and availability.
Right.
You can't really outsource the core surgery itself, not in that sense. So through this business lens, the active surgery is, well, it's skilled labor, incredibly skilled, but labor nonetheless.
It's not like a product you could just scale up infinitely or sell off the shelves without the person doing the actual work.
Exactly. It's tied to the person.
And directly linked to this is a concept the material highlights.
Yeah.
The 4 A's of private practice success.
Right, the 4 A's. Availability, halfability, ability, and advertisement.
Can you break those down a bit?
Sure. They suggest you need to be available, physically present to do the work, see patients, operate, affable, good with people, patients, colleagues, staff, just easy to work with. Ability, that's your core clinical skill, being a good surgeon. And advertisement, getting your name and services known, marketing yourself in the community or your market.
And all 4 are crucial, but they each need a different kind of focus, I guess.
Precisely.
The material then talks about 3 distinct business models a private practice neurosurgeon might navigate. First up is what they call business to customer, or B2C.
Yeah, and this model, it really emphasizes location, Which makes sense when you think about it from the patient's side, right?
Mm-hmm.
The articles highlight that most patients, they prefer care close to home. They've got that vital financial and, emotional support network of family and friends nearby.
Makes sense.
So for an early career neurosurgeon, their first patients are heavily reliant on building trust and recognition within that local sphere of influence.
And there's that great line the material uses, moving stones gather no moss.
Exactly. It suggests that constantly changing locations can really set you back when building a private practice. You lose the momentum, the reputation you built up.
You have to start over each time.
Pretty much. So the second model is business to business, or B2B.
Okay.
This involves interacting within the existing healthcare system. So understanding your competition, connecting with other surgeons, and critically, working with hospitals.
Right. Maybe joining forces.
Potentially, yes. Starting by joining a senior practitioner or working within a hospital system is presented as a common, pretty smart first step.
Why is that?
It provides that crucial financial flow, that steady income, and the exposure that a fresh graduate really needs to get established.
Okay.
And this model involves navigating a tricky decision point, when or even if you should change jobs or move on.
Oh, the timing.
Yeah. The sources advise caution against, making hasty decisions. They suggest staying at least 6 months in one place to really build confidence with the staff, the management, the local referral network.
What?
But on the flip side, they also say don't just, quote, waste away in a situation if there aren't real growth prospects. It's finding that balance.
Tricky balance.
Mm-hmm.
And finally, the third model is that transition from being essentially a laborer for someone else to becoming a business owner.
Yeah.
Setting up your own independent practice.
This is the big leap. It means establishing your own clinic, managing OR bookings, ICU beds, wards, the whole setup.
Wow.
And the articles are clear. Factors like real estate costs, marketing spend, the huge expense of specialized equipment.
Yeah, I bet.
And just finding and keeping trained staff. These are all critical things to figure out.
And importantly, all those operational costs directly influence the final cost of treatment for the patient.
Which brings us right back to the patient's viewpoint. Cost is a huge factor in where people choose to get care.
Definitely.
And the material notes this kind of striking difference.
Yeah.
You might have major tertiary centers with waiting lists stretching months, even years, while maybe corporate hospitals in the same city are only doing 1 or 2 surgeries a week. Now, obviously, many factors are involved. But the sources suggest this could be linked, partly anyway, to the cost of care at different types of places.
So in that kind of environment, standing out is absolutely essential. This is where that idea of a unique selling proposition, or USP, comes in.
Exactly. What makes you, as a neurosurgeon, different? Why should someone choose you?
What are some examples they give?
Well, the material lists things like, maybe it's your specific experience in really complex cases, or do you offer unique services like advanced neuroendoscopy or specific spinal techniques?
Or tech.
Or tech, yeah. Leveraging cutting-edge stuff like neuronavigation systems, or maybe you can offer more competitive costs.
Or just being more available.
Or simply being more available, yeah. Known for taking on tough emergencies or being willing to travel to areas that need services. Your USP is what helps patients and referring doctors pick you out from the crowd.
So thinking about building this practice, the articles frame it in an interesting way, like a single-person service startup that wants to grow into a proper company structure.
Yeah, you need marketing, advertising, you need to manage your product acquisition, which is basically your ability to provide certain types of care.
Right.
Finance, and eventually HR, human resources.
And they talk about marketing options too, right? Both old and new.
They do. The traditional routes like newspapers, local TV, pamphlets, maybe setting up health camps. Those are still relevant in some places. But increasingly, it's the newer media.
Yeah.
Social platforms like YouTube, Facebook, Instagram for building visibility, educating people.
SEO and stuff.
Yep. Search engine strategies, Google AdWords, SEO, so people find you online. And also those aggregator websites, Practo, Librate, 𝗗𝗶𝘀𝗰𝗶, they act like directories and booking platforms.
And key to all this business stuff is really understanding the local market, specifically how people pay and what the demand is like.
Absolutely. Health insurance penetration is called out as a major factor.
Why is that so key?
Because it fundamentally dictates what treatments are financially viable for patients and whether investing in that expensive specialized technology is even feasible for your practice.
Right. Can people actually afford the care you offer with that tech?
Exactly. And they stress the importance of local education, too, making the community aware of financing options.
Like what?
Things like microinsurance products, microcredit schemes for medical bills, or government health programs. Educating people on these can significantly increase access and demand for your services.
It's not just about offering the care. People need to know how they can actually pay for it.
Precisely.
There's a specific example mentioned that's really fascinating: international medical tourism, particularly in India.
Yes, this is shown as a powerful win-win. It helps patients from countries where advanced care is either hard to access or just prohibitively expensive.
Like where?
Places like the Middle East, parts of Eastern Europe, even people from the US and Australia facing long waits or huge bills. They travel to India for high-quality care at much more affordable prices, and for the providers there, it generates higher rates than they might get from local patients.
So it's leveraging global demand and local supply.
Exactly. A really interesting dynamic.
Okay, so pulling back a bit, the material you shared, especially the pieces on streamlining operations, really hammers home that administrative burden we mentioned earlier.
Right, the non-clinical workload.
It repeats the problem. Neurosurgeons, even with their super specialized clinical work, are often just completely bogged down by tons of non-clinical tasks. Paperwork, getting insurance approvals, chasing bills, scheduling complex procedures. It sounds exhausting.
It really does. And this is precisely where healthcare business process outsourcing, or BPO, comes into the picture as a potential solution.
Okay, BPO.
Yeah, the basic idea is delegating these non-core administrative tasks to specialized third-party companies.
So what kind of tasks are we talking about specifically?
The material defines healthcare BPO as handling functions like billing, coding, transcription, processing claims, verifying insurance, getting prior authorizations, and provider credentialing. All that back-end stuff.
And across the sources, they list a whole range of specific BPO services that tackle these headaches directly.
Like what?
Things like virtual medical assistants, AI-powered virtual receptionists.
Using AI.
Yeah, AI for reception, even live video medical assistants for intake tasks, AI for prior authorization processing, AI medical scribing to handle the clinical notes.
Wow, okay.
Medical coding, medical data entry, and then full revenue cycle management, RCM.
So really covering that whole administrative and financial workflow.
Seems like it. And the material highlights some pretty significant benefits to outsourcing this stuff.
What's the main one?
The most compelling benefit they mention is improved focus on patient care.
Makes sense.
It's intuitive, right?
Yeah.
If you hand off the admin load, it frees up the neurosurgeon and their key clinical staff to actually spend more time doing what they're trained for, providing care.
That seems huge. Any others?
Yeah, they also point to substantial cost savings. One piece specifically mentioned potential savings of up to 70% on staffing costs for these admin roles.
70%. That's enormous. That could really impact a practice's finances.
Definitely. Plus, they mentioned enhanced offerings, freeing up resources, both people and money, to maybe introduce new specialized services.
And fewer errors, maybe.
And critically minimized errors. Because these outsourced partners are, skilled experts. They specialize in complex areas like medical coding or insurance rules.
Right. That access to specialized expertise is key. These are trained pros whose only job is mastering these admin areas. Something a busy surgeon or nurse just doesn't have the bandwidth for. The articles really frame outsourcing not just as convenient, but as almost a strategic necessity today.
To handle rising demands, cut costs.
Exactly. Ensure smoother workflows and help practices move from being constantly reactive to proactively managing their operations.
And this impacts the patient directly, right? By improving interactions, reducing bottlenecks.
Absolutely. The sources even cite stats, I think, from Salesforce and PwC, showing that consumer satisfaction with healthcare's focus on the business and customer experience side is pretty low.
Interesting.
So streamlining, maybe through outsourcing, becomes critical not just for the practice's health, but for the actual patient experience.
They also touch on proactive communication.
Right.
Right. Keeping patients in the loop.
Yes. And consistency. Providers need accessible digital tools, sure, but patients also need responsive support. Things like proactive notifications, email, or texts about appointments or billing. And using an omni-channel approach so the patient gets a unified, less frustrating experience no matter how they contact the practice.
Of course, choosing the right outsourcing partner must be absolutely vital.
Oh, for sure. They need proven expertise in those critical areas: prior auth, insurance verification, RCM. And their services have to really align with the practice's specific needs for it to work smoothly.
And what about security, patient data?
Huge emphasis on that. The healthcare BPO source details the crucial need for partners to strictly follow regulations like 𝗗𝗶𝘀𝗶𝗺,
Right.
using business associate agreements or BAAs to protect data, often holding tough certifications like ISO 27001 or ISO C2 Type 2.
So real security measures.
Yeah, things like encryption, multi-factor authentication, continuous monitoring. It has to be secure.
Interestingly, the material you shared actually mentions one company by name here as an example provider, Staffingly Inc.
Oh, yeah. What did they say?
They're highlighted as focusing on helping healthcare providers streamline operations, handle those admin headaches, specifically mentioning their work on prior auth, RCM, scheduling, and emphasizing that they understand healthcare's complexity and compliance needs.
Good to have a concrete example. Shifting gears a bit, the sources also briefly touch on how these career challenges, the whole landscape for neurosurgeons, can vary quite a bit depending on the country.
Right, internationally. They talk about how differences often come down to factors like insurance coverage and how jobs or training slots are regulated.
So, for example...
And in places like the U.S., Australia, Canada, you have high private insurance penetration. That drives higher costs and salaries. But also, maybe surprisingly, they mention increasing unemployment trends for some neurosurgeons there.
What about Europe?
European countries often have state-sponsored insurance. That tends to mean more standardized salaries, reliance on referral systems. Surgeons might move into private practice later on. China is mentioned as heavily focused on public institutes, academic competition. And then there's that India example we already talked about with its big international medical tourism market.
So it really boils down to a couple of key factors globally, according to the articles. The fundamental demand-supply principle for their specialized skill and the level of medical insurance penetration, whether that's private or state-run. Those two things really shape the career path.
Makes sense. And finally, the material brings up something a bit more personal character.
Yes. It emphasizes that demanding professions like neurosurgery require what they call unbreakable character.
What does that mean in this context?
The focus, according to the sources, shouldn't just be on immediate money, especially early on. Instead, it should be on consistently doing respectable and focused work and having the will, as they put it, to apply your skills and do good work whenever the opportunity comes up.
So bringing this all back around, thinking of you, the listener, how does understanding this whole business side of a super specialized field like neurosurgery maybe change your perspective on the healthcare system overall?
Yeah, the relevance here is pretty broad, isn't it? This isn't just about the doctors themselves. It's about how operational efficiency, cost management pressure, the weight of admin burdens or successfully getting rid of them ultimately impacts patient care, your access to services, and your experience when you interact with the system.
Totally. If highly skilled doctors and their staff are drowning in paperwork and tasks that aren't direct patient care, that inevitably takes time and energy away from the main mission, delivering quality care.
Exactly. So streamlining those operations, maybe using strategies like outsourcing, isn't just some internal business decision for a hospital or clinic. It has direct ripple effects on how easy care is to get, how quickly you get it, and the quality of that interaction you have as a patient.
So we've taken this deep dive into these unexpected business challenges neurosurgeons face after residency. We've looked at the different models for building a practice and seen how outsourcing is presented as one strategic way to free up that precious time and those resources.
It really paints a complex picture, doesn't it? Where incredible clinical skill has to be paired with a pretty savvy understanding of business principles to really succeed and, more importantly, effectively serve patients in today's healthcare world.
And this leaves us with a final thought-provoking question, drawn right from the sources. If the core work of a neurosurgeon is viewed through that business lens as highly specialized labor, and success means navigating complex business models and tons of admin, does using outsourcing strategically transform that core labor? Or does it just enable it to be done more effectively by clearing away the non-core distractions?
Or maybe put another way, consider it focusing on these business principles, including efficient outsourcing, isn't actually a distraction from patient care at all. But maybe it's a necessary, even essential foundation for delivering quality patient care effectively here in the 21st century.
Something worth thinking about next time you interact with the healthcare system. Thanks for joining us on this deep dive.